The next morning after my pacemaker was implanted, I felt remarkable. I felt great. I was literally wanting to just get back to work and go home. And they discharged me that afternoon. I went home. And so they told me that I should be good now. Pacemaker should sustain me. Many people receive pacemakers and they live long, normal lives with today's technology and advancements in medicine. So I was confident with that, even though at my age, having been an athlete all my life and having been very active in my life with my community, with owning businesses, with having a career in science, being married and having kids, it was kind of a shocker that I now have a pacemaker at age 40. So I adjusted to that and resumed back to my normal lifestyle. But a little bit over a year after that, I continued to have problems. I started having more abnormal rhythms in my heart. This time, though, these abnormal rhythms were not on the top chambers of my heart, they were on the bottom chambers of my heart. These are the chambers that provide blood to your lungs and to the rest of your body. So my symptoms, needless to say, were a lot more severe. I was retaining water. I was having rhythms, what they call ventricular tachycardia. My heart was beating at 140 to 170 beats per minute. It was like running a marathon for days and for hours. So when you do that, like any other muscle, your heart's muscle is going to get fatigued. It's going to enlarge. It's going to, it's going to develop disease. And that's exactly what it did. So I went to the emergency room again, and they did not really know what was going on initially. They just knew I developed cardiomyopathy in such a short period of time. My heart was enlarged. My heart function had declined substantially. Normal heart function is anywhere, at my age at the time, would be, anywhere between, say, 50, as far as cardiac output, 50% to 70%. Mine was down to like 35%, which was very unhealthy, very abnormal. So And
you were 41 around this time?
Yeah, I was about 41 years old. And the doctor decided, well, we don't know what's going on. You have a pacemaker, but you're still having all these arrhythmias. Why don't we evaluate your blood vessels to check and see that you may have a blockage or atherosclerosis or some kind of a blood clot or something that's blocking blood flow to your heart muscle and causing it to get diseased. They did that, and sure enough, my blood vessels, indicative of my healthy diet and my exercising previously, they were clear. Everything was pretty healthy in my blood vessels, but my heart condition continued to progress. And they gave me medications. That's all they knew to do at the time. They couldn't quite figure it out, so they gave me beta blockers, pretty strong doses of beta blockers at age 41. Beta blockers, they're important. It's an important medication to help prevent and or slow down the progression of heart disease, and help you with arrhythmias and reduce the amount of arrhythmias that you're getting, but they also make you fatigued. They stifle you, they lower your blood pressure. At my age, that was kind of difficult, but it's what I needed to do. So I took the medication, and
so your quality of life had changed?
Substantially. Yeah, my quality of life had begun to change. I found that I didn't have much energy. I was constantly having to watch my water. I was retaining water. They also gave me diuretics to help me pump out some of the water. Every time I was admitted, they would give me diuretics intravenously to help me get rid of some of the fluid that I was accumulating, because when your heart's not working normally, you'll tend to accumulate fluid and add more congestion and more pressure to your heart, just worsens things. And so a few months after taking the medication, my condition did not improve. It did not change. I continued to get worse, to the point where I had to go back to the hospital. Luckily, during this time frame, I had been going to a different hospital because of my health insurance. But I also knew that these doctors that I was going to at that previous hospital, while they were good physicians, a good facility, they were not researching it. They were not trying to figure it out enough, in my opinion. So I thought at that point, I need to get some more answers. Why is my condition continuing to progress? Nobody knows why, but I'm just getting sicker and sicker.
And it's probably very scary.
Oh, extremely scary, yeah, to not know what's gonna happen, not know what my future holds at that moment, and not know what's causing it. I wanted answers, so I switched health insurances, which allowed me to go to a different facility. This time when I was admitted, I remember going to the emergency room. I was quite scared. I was very agitated, not only because of the heart condition, but also because I didn't have any answers and nobody could give me more answers. So I told the emergency room nurses and the emergency room physician a brief synopsis of my history, and that I wanted some answers this time. I wanted them to get me with a physician. I knew enough in my education that I needed a specialist that would not just a cardiologist, but somebody that specialized in conduction disorders, electrophysiologist. So I said, I want an electrophysiologist. I want somebody that's going to help me figure this out. I need some answers. And I did a little bit of research because this has to be, you know, well, I knew my mom had a pacemaker and some other family members had pacemakers, but I didn't know to the extent of what the progression was because I never really looked into it. But I knew that there was something potentially familial, something hereditary ran in the family. So I told them I want somebody to help me do genetic studies to try to get me some answers. So sure enough, they knew exactly who I needed to go to. They said, oh, we know who you need to see. There's this wonderful physician, her name is Dr. Khoo, and you need to go see her. She's the one that we want you to see.